Nobody brought me 9 a.m. medicine. I went to the nurse's station, the back nurse's station, the closest one, because I wasn't going to walk all the way to the front where they actually keep my medicine. Who knows why? It's inconvenient for the nurses, it's inconvenient for me. I went to the back nurse's station to ask them to get my nurse here because I'm in pain. And my pain medicine at 9 a.m. was late, and there was nobody at the back nurse's station, just empty. I looked in the back, there was nobody in the rooms inside the nurse's station. And then when I came out of the nurse's station, there was the supervisor of nursing, Elizabeth, at a cart a couple doors away. By room, I think it's 24 doorway. And the janitor, the thief, Maria, the one that steals from my room, the one that raided my room with the owner and another woman I suspect is an owner who works in the office here, the owner who is the director of physical therapy, and the woman that works in the office. 2 different raids, a couple months apart, supposedly to do deep cleaning, which is washing the floor, to try to remove evidence of the people that trespass into my room, that inflict injuries on me, like this one, and this that's done to my hair, and all the cuts and bruises and black eyes and stretching of the skin and injections of fillers into my face and neck and body. Anyway, the chemical restraint that I took at 9:30 when I finally was able to get the nurse to bring my medicine. It's about 10 minutes later, and there must have been something on the surface of the pill because it came straight out of the package, the blister pack. And so either it was on the surface of the tablet inside the blister pack, or it was in the cup that she put the medicine into. But anyway, something is making me all lightheaded right now, and I'm just starting to ramble and lose my train of thought. So I'm going to try to keep on track with what I'm recording this about. So I'm still in pain. I'm all woozy. The chemical restraint has already made me, my ears are ringing, my mouth is drying out. The past few days I've had problems with limbs going to sleep, numbness of my feet and hands and arms and legs, and that's actually happening right now. My right hand is feeling numb all of a sudden. But I'm still in pain. My face hurts from these wounds that have been inflicted. My body hurts from the pain that I take the painkillers for and the muscle relaxers for to begin with. I'm having muscle spasms even though I took the muscle spasm medicine at 6 a.m. and it's now about 9:45 a.m. and it's supposed to, I don't get another muscle relaxer until noon, so I should have 0 muscle spasms. And the medicine that they continue to give me, that this facility continues to give me, is chemical restraints. If they have any of the medicine I'm prescribed in them whatsoever, if they have any hydrocodone, oxycodone, and carisoprodol, those are the generic names for Norco. I take Norco 10, 325, oxycodone 10 milligram, Soma 350 milligram. if there is any active ingredient of those two narcotic opioid pain relievers or any of that skeletal muscle relaxer in these tablets that I'm being given that are coming out of blister packs from the pharmacy, Milbray's preferred pharmacy, they're vastly subpotent. If there's any of those medicines that I'm prescribed in the tablets I'm taking, it is so little that I'm still in pain and still having muscle spasms. But I'm experiencing all of the side effects from the chemical restraints. I randomly fall asleep. I think it was yesterday or the day before. I lose track of time because I'm knocked unconscious by these pills so much of the time, like most of the day, and when I'm awake, I'm usually so drugged that I'm just over sedated, and the medicines that I'm prescribed don't sedate me at all. They don't interfere with my clear-headedness or my ability to function whatsoever. All they do is they get me out of pain and control the muscle spasms. They relieve me of pain and muscle spasms. That's it. They don't cause any other side effects, any adverse effects. That's why I take those particular medicines after spending a lot of time with first Stanford Pain Clinic after spinal fusion. I went to Stanford Pain Clinic for 6 months, extremely unsatisfactory, saw a different doctor every time, had to tell my entire medical history to a stranger every time. They were all arrogant and would keep patients waiting. You'd have an appointment and they'd show up whenever they felt like it. They'd keep you waiting for hours, and you're stuck waiting for them because you need the medicine, because you just had spine fusion and you're in pain. I changed. I went to Spine Care Medical Group. The difference was night and day. They were professional. They knew what they were doing. I spent a year trying. I didn't want to take narcotics and muscle relaxers. I didn't want to take anything that was a controlled substance. If I could take an over-the-counter, I didn't want anything that interfered with my ability to think and function. But I ended up taking a couple of dozen different medicines. A bunch of them didn't get me out of pain, didn't stop the muscle spasms, but had all kinds of adverse effects, and I had allergies to different drugs, and I kept a spreadsheet of each medicine I was prescribed, the name, the strength, the frequency I took it, the effects it had, its effectiveness in controlling what it was supposed to control, the duration of onset, how long it lasted, exactly what it did. And I ended up finding that the medicines that worked, and luckily they're inexpensive, and so for every single possible reason, they're the right medicines. They're effective and they're inexpensive, and they don't cause adverse side effects, and they leave me clear-headed and able to do what I need to do. Now, my physical functioning is another story, since I'm sick with a bunch of things related to the illness that I have, as well as having been struck by a reckless driver and crushed 3 discs in my spine, and then over time my entire spine just pretty much was affected by scar tissue and collapse and arthritis, and so I'm highly physically disabled and fragile. And again, I'm just kind of rambling right now, but the point that I was trying to make is that I I take particular medicines. I've been taking them for 20 years, and even though they're intended for short-term use, I also tried other things besides medicine. I tried TENS, I tried all kinds of physical therapy, I tried everything that was possible to try. I tried it. Spine Care Medical Group was thorough, they were professional, and I had the facet point injections. I had every possible treatment, and it just turned out that things like the TENS vibration, not effective. Even it didn't control any pain and spasms when the TENS was off, and you can't leave it on 24 hours. And when it was on, it didn't manage pain and spasms effectively either. So just, these are the right medicines. But the ones that I'm being given from Milbray's Preferred Pharmacy are not the medicines I've been taking for 20 years.